Well, less than 3 months ago, 2 Oahu hospitals closed. Now, some days, the remaining medical centers are running out of room for emergency patients. KITV4's Paul Drews has the details in tonight's top story.
On a busy day, Oahu ambulances will take 165 patients to various island hospitals. But lately, emergency responders have noticed a disturbing trend.
Since December, and even more so over the last few weeks, and particularly the last week, we've seen more hospitals on reroute, especially multiple hospitals at the same time, really than we've seen in years.
Rerouting of patients is done when emergency rooms are too full or too busy. It can be done with minimal impacts on patients when it's just 1 or 2. But some days, ambulances are diverted from 6 of the island's 9 hospitals.
If that block of hospitals on the central and west Oahu are on reroute, then the next closest hospital is Kuakini. So Kuakini then will become overwhelmed with ambulances from Wailua and Waianae and Ewa Beach and all over.
That can add 20 minutes to a typical ambulance trip to the ER. Extra EMS staff is helping to handle emergencies where hospitals used to be located, but now paramedics worry they'll run out of places to take patients.
We want patients to go to hospitals that can handle the care and feel, because when they go on reroute, they're telling us that they're overwhelmed.
Since the closure of Hawaii Medical Centers East and West, Oahu hospitals have seen an increase in regular beds filling up. Adding to the problem, some hospitals say there's not enough long-term care facilities to take additional patients that could be transferred. That means sometimes those in the ER can't even be admitted, and ambulances are diverted. ERs are never closed. They'll always take patients who are critical, but the backlog means all patients will have longer waits. Ireland is especially concerned because medical centers have been reaching capacity so frequently without any major accidents or catastrophes, and feels something needs to be done.
We really need that hospital to open up in the west.
And this isn't a problem, just a problem for Oahu patients. Full hospitals also force neighbor island patients to reschedule procedures and wait until more beds are available. And as unusual as it sounds, there's even been talk about what to do in the worst case scenario. If all the Oahu hospitals are on reroute, which of the neighbor island hospitals patients would go to and just how they'd get there.